Hi, I'm Leslie Jackson, and today I'm going to talk to you about HIV, the human immunodeficiency virus. So HIV damages and weakens the human immune system. Specifically, it attacks the CD4 T cells. These T cells are the immunoresponse cells. They seek out and destroy invaders. Without a healthy amount of these cells, it diminishes the body's ability to fight and protect itself from disease and infection. Some of the HIV risk factors include geography, and that's just where you live. In the United States, the Northeast has the highest rate of transmission, and so that just means living in the Northeast, there's a little bit higher of a risk factor. Globally, Africa accounts for 65% of HIV infections. Some other risk factors include your sexual partners, and that's just being safe and selective and knowledgeable about your partner, so sharing important information and taking preventative measures together. Risky behaviors include drugs and sharing needles, so if that's something you encounter, just making sure that these needles are sterile and protecting yourself through that. Some HIV myths include that it can be transmitted through air and water. It cannot be transmitted through saliva, sweat, and tears. Insects or pets do not transmit HIV, and sharing toilets or drinks is not a form of transmission. So HIV's source has been traced back to a type of chimp in Africa. The chimp is thought to have a version, or was thought to have a version of HIV, and then through transmission to a human, it mutated into what we know as HIV today. There are 3 stages of progress with HIV. The first stage is acute, and this is the first 2 to 4 weeks post-infection. The individual may not and probably is not aware of the infection. They may not feel ill at all, but if they do, they may attribute these symptoms to a flu-like feeling illness. It's highly contagious in the acute stage, so that's extremely dangerous because the individual doesn't even or may not realize they have it. Stage 2 is clinical latency, and this is inactivity. So the individual is asymptomatic. The virus is still very present in the body, but they're just not experiencing the symptoms. So this stage can last years if they're not in treatment before it goes into stage 3. But for those in treatment, they may, with the help of medicine and being diligent and responsible, they may be able to remain in this stage for a very long period of time, so they can still live their life and go on and just not experience too many symptoms of their HIV disease, but they still can transmit the disease, and it still requires them to be very diligent and responsible with their illness. If they're not in treatment, or treatment is not working, or they're not being responsible with treatment, the virus load can increase and it becomes more present in the body. This attacks more of the T cells, causing them to decrease, and your body's ability to fight also decreases, and this can lead into the more severe case of HIV that we know as AIDS. Stage 3 is the acquired immunodeficiency syndrome, also known as AIDS. This is the most severe stage, and the body's immune system response is very badly damaged. It's really high risk of disease and illness in this stage. This is called opportunistic illness. So as the body's immune system is really damaged and weakened and just depleted, disease will take advantage, and it's much easier for disease to take over the body at this point. Some symptoms will be chills, fever, swollen lymph glands, weight loss, and also a much higher risk of illness and disease. Without treatment, an individual can live for about 3 years in stage 3. So some preventative measures. Abstinence is a very effective form of prevention. but it may not be the most realistic for everybody, and so there's other forms of prevention that are really important to recognize and utilize. So that's limited sex partners, or just being knowledgeable about your sex partners, sharing information, and taking preventative measures together. Never share needles, and using condoms every time. The DHAP plan envisioned to fight HIV. They are the Division of HIV/AIDS Prevention, and some of their main goals is to reduce the annual number of new HIV infections and reduce the transmission rate, and also the percentage of people living unaware. Being aware of this disease is critical to reducing transition rate and the new infections. They also want to increase access to care and improving the health outcomes for people with HIV. So that's as they've been diagnosed and they have HIV. So just making those outcomes of living with this. There is no cure, but there is management, and so just making that as livable as possible. And they want to reduce HIV-related health disparities by improving access to prevention and care, and especially to those target audiences. So CDC's prevention, they have a high-impact approach of reducing infection. They are looking for significant results and tangible results. In 2015, this was a major year of change and progress. They were able to increase testing, increase awareness, and most don't know the status of their disease, but if they do, and you can increase awareness, they can properly take care of it, and that was a huge factor they had in mind and was a goal for them. And the implementation of the Affordable Care Act increased critical testing, created more prevention and care services, and brought that heavy awareness and availability to target audiences. They also wanted to put accountability to every level, so that's the individual who is responsible for themselves and the health of those around them, and also the people who are creating and implementing these public policy plans. So some of the demographics, race, there's a little bit of a race and ethnicity difference between, for this disease. African Americans are the most affected at 45% of HIV infection, and Hispanics represent 24% of HIV infection, and that can be seen on the pie chart. Gay and bisexual men are the most at risk for this disease all around, at 67% of diagnoses. Living with HIV, it's really important to stay healthy and take care of your body. Your body is constantly fighting a virus inside of it, and so the more you can do to stay on top of treatment and keep other aspects of your body healthy, the better results you'll see. Get support. This is a life-changing diagnosis, and to have a support system to help through this challenging time can be crucial. Tell others. It's easy to feel like this is a taboo subject, or it should be a personal secret, but there are appropriate times to educate others of risk and put it out there that this can happen to you, and maybe you didn't think that this could happen, but it did. Inform your future partners. Let them be aware of their risk and be in charge of their own preventative measures, and just reduce the risk to others. Prevention efforts support that every individual has the right to resources to protect themselves against HIV. Knowing if you have HIV is powerful. Protect and care for yourself and others.